Hello, I'm Dr. Alex Chasnis, and I'm a physiatrist at OrthoCarolina, working out of our Huntersville office. I get the question a lot about what is a physiatrist? Is it a podiatrist? Is it a pediatrician? Is it a psychologist? Or any of those medical specialties that deal with P? Physiatry is the branch of medicine that deals with improving patients' function and quality of life in patients who have various impairments or disabilities. The OrthoCarolina physiatrists have specialized within the area of spine medicine, specifically non-operative spine medicine. The part that makes us unique is the skill of being able to inject different potential pain generators in the spine. Just like a surgeon, a spine surgeon will use his scalpel as the unique part of his practice, we will use the needle. So we get a lot of questions regarding injections. How do they work? Is it a Band-Aid? Is it some kind of temporary fix? Is it just masking something? And I think it's important to have a further in-depth discussion on this topic to kind of really understand how injections work. For starters, injections don't change the structure of the spine. It is a strong anti-inflammatory. It's typically a corticosteroid or cortisone type injection that we use. Injection treatments really depend on the ability to isolate a specific pain generator that we think might be causing somebody's symptoms. If we can identify a specific nerve or a few isolated joints that we think could be causing the pain, then we may try injection treatments. And these injections are usually done under fluoroscopic guidance. Very similar to any other injection, but the main difference is that we do it under an x-ray so we can see and be accurate and place the medication directly as close to the pain generator as we can. And a good way to think of this is that we're trying to treat this problem chemically by reducing inflammation and take away pain in that manner, as opposed to treating something surgically, which involves physically going in and changing the structure of the spine. So there's two major structures that we commonly target with injections. Either a nerve that is getting pinched, or secondly, an arthritic structure if we can identify a specific structure to target with an injection treatment. There are two places where nerves tend to get pinched. The first is the side hole where the nerve comes out, and the other is right down the middle of the spinal canal where I've placed this pin. This is our spinal cord, this gray structure. The spinal cord actually ends at this point, and then it gives off all these little nerves that run up and down through the spinal canal. You can see as we track down to this area through here, the spinal canal is narrowed. We call that stenosis. And then once we get through those two areas of narrowing, it opens back up again. The other kind of common injection that we do on the spine to target arthritis relates to these joints where the bones actually clip together. So you can see on the front of the spine, the bones tend to be separated by a disc, and then on the back of the spine, those bones actually clip together at these small little joints. Many times these small little joints become arthritic and painful, and if we can isolate which joint we think it is, we will target that specific joint. So what are the type of things that patients consider when they're trying to determine if they want to move forward with an injection? First of all, some of these patients have already been through more conservative treatment like physical therapy and medications and just haven't had the response that they were hoping for. Sometimes physical therapy is a time commitment and people don't have the time to attend physical therapy regularly, maybe due to job purposes or taking care of children. And then thirdly, sometimes physical therapy can actually aggravate or cause some discomfort. And finally, there may be patients who actually have a surgical problem and want surgery, but due to medical comorbidities, can't have surgery. And that makes the injections really the strongest treatment option they have to help manage their symptoms. The types of injections that we do in the spine typically can be performed on anybody of any age. It's relatively uncommon to have young people, including teenagers, to have spinal pain, but we do see young teenagers with disc herniation sometimes, and they do prefer to move forward with an injection as opposed to having surgery at such a young age. Also, there is no upper age limit on who can have an injection. At times, elderly people tend to have some cardiac or vascular issues and may end up on blood thinners, and the only requirement is that we do like to have them off blood thinners before we stick needles in their spinal area. Patients never need an injection. It is completely elective depending on whether they want to try it and whether it helps them. How often can they get injections? There are some rough guidelines that have been put forth by spine societies and organizations that try to guide us with that. Their recommendations suggest 3 injections in about a 6-month time frame or 4 injections in a year. But most importantly, I just tell patients we're going to use good judgment. And if something tends to provide very good, beneficial, relatively long-lasting relief, I'm okay with repeating it every so often, particularly in patients who may not have other treatment options available. So what can a patient expect when they have an injection? Patients typically will walk in for the procedure and they walk out within 10 to 15 minutes of the procedure. Their only restriction is usually to avoid driving for the first couple hours until the lidocaine anesthetic has worn off the nerves that control the leg. Usually the majority of patients that I see for injections tend to tell me that the worst part of their injection was either the anxiety before the injection or possibly the lidocaine to get everything numbed up. As with any injection, at times an injection may not be beneficial and provide the amount or degree of relief that we want, in which case we may choose to inject a different area or abandon injection treatments altogether and try other treatment options. One last thing I want to mention when I hear patients talk about, is this just a Band-Aid or a temporary fix? They seem to be focused more on what a picture might show, or maybe somebody told them they had a bone spur, or possibly they read an MRI report that said they have a disc bulge. And they tend to focus more on what something looks like, and in reality, we don't treat pictures. We treat pain and we treat symptoms. If we treated structures, everybody would have an endless number of spine surgeries performed on their body from the neck to the low back over the course of their lifetime, and that's not reality. So in conclusion, if you're having spine pain that interferes with your quality of life and you're wondering whether there's something else that can be done, either surgical or non-surgical, make an appointment to either see me in our Huntersville or Mooresville office or even one of our OrthoCarolina providers. We now offer online scheduling.